All right, so welcome everyone. I'm Hannah. I'm the assistant director here at the Blue Hill Library, and I wanted to welcome you all to our virtual event for this evening. Give a big thank you to Northern Light Blue Hill Hospital that is co-sponsoring this with us, especially Kelly Columber, who's here with us, who kind of helped me put this all together. We are very happy tonight to have Dr. Mike Marnick, as well as Joe Gaetano from Blue Hill Hospital to answer your questions on all things vaccine related. I've got a bunch of questions here kind of in front of me that are some that we kind of came up with in advance and others that folks have sent in ahead of time. So we'll kind of work our way through those, and then we'll also have some time towards the end for more like live Q&A. If people want to type questions into the chat as they're occurring to you, feel free to do that, and then I'll read them out as we go. Thank you again to Mike and Joe. Do you guys want to just say a quick hello before we dive into the questions and introduce yourselves a little bit and what you do with the hospital?
Sure, I can do that. I'll jump in first. I'm Mike Marnick. I'm a family practice doc. I've lived here for going on 15 years. First 8 years or so, I worked at Maine Coast Hospital in the hospital and the clinics there. And for the last going on 6 or so, I cut out the commute and have been living and working in Blue Hill. I'm the senior physician executive for the hospital, and I practice half-time in the clinic.
Okay, so I'm the new kid on the block. Maybe not a kid anymore, but name's Joe Gaetano. I'm VP of Operations for Blue Hill Hospital and Maine Coast Hospital, as well as the physician practices. I've been with Northern Light Health for about 6 months, but my history goes back probably over 20 years, working with Northern Light, Eastern Maine Healthcare at the time. Was very much involved with the information technology implementations way back, I think working with John, it might have been 20 years ago. So a lot of familiarity working with the folks here. And I'm living in Castine, so right there in Hancock County, and thrilled to be here.
Probably shouldn't be.
See, I'm just going to go ahead and mute you, Paul, while we're going. Great, so that we don't have any background interference. Okay, so just to start out with kind of broad strokes, I was hoping, and maybe this is a question for Mike, or maybe you guys want to tag team it, but if we can just get some kind of baseline information about how do these vaccines work? Everybody's hearing about the vaccine rollout and how effective they are against COVID-19, but what do they actually do, and what should people know about them going in?
Sure, it's interesting, and it's caused some anxiety amongst folks. It really is a new way of doing vaccines. It's the first time we've done mRNA vaccines in humans, but they have proven themselves now in millions of people. At least in short term, being very effective and safe. What it does is a typical old-fashioned vaccine is you grind up the bacteria, the virus, and you get parts of it, and you inject that into your body, and your body develops antibodies to those parts, those proteins and parts of the bacteria or virus. With this one, there's no virus ground up and injected into you or purified and injected into you. They figured out, they were working on this before COVID became a thing. They were working on having a small segment of messenger RNA, mRNA, which is the genetic material that codes for proteins to be made in the cell, and finding a way to get that to be absorbed into the cell, runs through the cellular machinery, never gets to the nucleus, never gets near your DNA, produces the spike protein, the one that you see in all those pictures of the coronavirus with all those spikes sticking out all over it, and just produces that spike, and your body cells crank that out, and your body develops thousands, probably more than thousands of antibodies to all aspects of that spike protein. And then the mRNA doesn't last very long and degrades, and your body develops all those antibodies and keeps them going, and then it gets boosted 3 to 4 weeks later. So it's a new way of doing things, but it may have changed the way we do vaccines for a lot of things forever, because we're getting pretty good at snipping those little clips of DNA, creating mRNA. We should be able to do this against almost anything. So it's pretty exciting. Using your own body's machinery and immune system to develop immunity to this virus. There are 2 brands that do it that way, the Pfizer BioNTech and then the Moderna vaccine. They both very parallel, very similar products. Pfizer famous for having to be kept super cold, and the Moderna travels a little better because it doesn't have to be kept super cold. And there's more on the way that operate in different ways. Pretty sure that Johnson & Johnson is a much more traditional one-shot vaccine. Novavax similarly so, and AstraZeneca is another one that may be on the way. But the 2 that we have with us now are the mRNA vaccines.
Great, thank you. And I actually had a question from someone earlier today who was asking, who's using Pfizer versus Moderna? Like, is there one that's being used in the Blue Hill area? Do you get a different one if you go up to Bangor? Is there any sense of how those are being distributed?
Yeah, I've been doing all the time. Joe, you want to take that one? Because that's really a handling thing and facilities thing, and who's got the bigger freezer?
Yeah, absolutely. So we're using the Moderna vaccine here in Blue Hill and also at Maine Coast. So all the vaccines that we're providing in Hancock County are the Moderna vaccine. And however, in Bangor at the Cross Center, to date, that's been primarily, where I should say 100% of the vaccine so far has been Pfizer. They have the cold storage capability there. And so the Pfizer vaccines have been directed there. So that could change, just like everything with COVID that continues to evolve. But right now, that's the plan. And it's real important to note that whatever you get for your first dose, you absolutely have to get the same vaccine for your second. And not only the same vaccine, but go back to the same exact site that you received your first dose at. So that's a real important part of that question.
Thank you. Yeah, that was actually also on our list as a later question. So I'm glad you mentioned that. Yeah, and so maybe one of you can speak to why do you need 2 doses? Why is it important to get that second dose? Because I think that's something unusual for a lot of people who are used to getting like your annual flu shot, something you just get once. You're still muted.
I'm muted. There we go. Partly because it's new. When a new young baby gets their first flu shot, we give them 2 shots a month apart. It sort of primes the immune system and then boosts it later. Some of the other immunization series are also boosted regularly. The hepatitis B vaccine is a series of 3. And just to get to the effectiveness they wanted. So studies are coming out now that after 1 shot, in the first couple of weeks, it's maybe 45% effective. After a month, it's close to 75% effective, which is darn good. But if you get that second booster shot at a month or 3 weeks, depending on the vaccine, it gets up to that pretty amazing 94, 96% effectiveness at preventing severe disease.
Right. And yeah, I mean, speaking of safety, I think a lot of people have concerns around the fact that these are so new, as we keep talking about. So how do we know these vaccines are safe?
Well, they have gone through rigorous review. They were sort of rushed to production, it seems, but the part that got rushed was the development part. The team that was working on these mRNA viruses was working on MERS, the Middle Eastern Respiratory Syndrome, a vaccine for that, which is another coronavirus. And they were right there. So when they got the DNA sample and sequence for the coronavirus, they just clipped and snipped and substituted, put in the new segment, and they were good to go. It took them 4 days, is my understanding, to go from getting the DNA sequence to having the product ready to go. And then they had a year to go through the testing and development. It was reviewed by the FDA. It's been reviewed internationally. It was reviewed by the U.S. Council on Immunization Practices, and passed muster on all those things. It's been in millions of people now, and we don't know what happens 10 years after, but we do know that it's effective, and seems to meet our standards for safety as well. The biggest thing is the allergic reactions, and we can deal with those short term.
Yeah, I see your hand up, Mr. Ronan, but just to follow that lead for just a little bit longer, if we can talk a little bit about, what if I have had allergies to vaccines in the past? What are these sort of adverse allergic reactions that people are having, and how worried should people be? Is it safe if you have some kind of allergy?
We take extra care if you have any kind of allergy, but the allergies we really worry about are anaphylaxis, the big full-blown, you have to carry an EpiPen, and most people know if they have that kind of reaction to vaccines or medicines. We're watching everybody for 15 minutes after they get their shot. That's the biggest slowdown in these mass production vaccine sites, is the observation part. If you've had an allergic reaction to something in the past, we'll watch you for 30 minutes to make sure nothing happens. And we've got staff on site. We're prepared to deal with any kind of allergic emergency. We've got EpiPens on site. We've got nurses that are trained in it. But if you just have an allergy to sulfa drugs, it isn't too bad. You shouldn't be terribly worried. It's more the anaphylactic type reaction. And the reactions that most people are getting are not allergic reactions. A sore arm, some shaking chills, some feeling feverish, feeling like you're coming down with something. That's just your immune system kicking in, and that's what we want.
Great. Thank you. Mr. Ronan, I'll let you go ahead if you want to unmute yourself.
I just, Dr. Marnick mentioned something that I didn't know, maybe others don't know, that coronavirus, we first heard about it maybe a year ago, but the medical profession and others have known about coronavirus for years and studied it in medical school. And maybe you could say a word on that, Mike?
Sure. I mean, coronaviruses are very common. Many of the common colds are coronaviruses. SARS, which many of you may remember from about 18 years ago, coming out of China, was a coronavirus that public health measures pretty much stopped, so we didn't get to this point. MERS was the Middle East Respiratory Syndrome virus, came out of the Middle East. Also similarly contained, it didn't have the right characteristics to spread as far as this one has. So there were people studying coronaviruses and poised and ready to jump on this one when it got as far as it did. And yeah, this is a new pathogen. It's a new virus that's causing disease in humans only for the last 18 months or so. So it's really pretty incredible we've gotten to this point with the vaccines and the response.
Yeah, definitely. Just to return to a couple more questions related to safety, I had someone ask, and maybe Joe can speak to this one a little more, do I sign away liability for adverse reactions to the vaccine if I get it?
Yeah, so there's actually a consent for treatment that you would sign to get the vaccine. But if it helps anyone feel a little bit better, I found this to be really interesting that of our physicians across Hancock County that I see come into the clinics for the vaccine, we've vaccinated well over 90%. So the largest group of folks so far that have accepted the vaccine are the folks that know about the science the most. And I thought that was really comforting to see. So we're proud to share that with you. So the folks that know are stepping up and getting it too. So it's a good testimony to the belief in the safety of the program.
As to the liability question, when you sign that release, you're just acknowledging that someone told you about this stuff and that you have heard that there are possibilities of reaction to such. You're not signing away all liability. I haven't thought about this specifically, so I may be speaking a little bit out of school, but most vaccinations are covered by a national policy that takes care of any problems that happen with vaccines. And operating under an emergency use authorization, so the details may be a little different, but I would assume the coverage for liability would be similar. But you're not signing your life away, you're not signing away everything. You're acknowledging that you've been informed about the possibilities.
And another kind of specific question was, is there a concern if I'm taking Eliquis, a blood thinner, for Afib if I get the vaccine? That's a very specific one, but.
No, it makes sense. Yeah, so Eliquis is a blood thinner, increases the risk of bleeding, but this is a very small needle. It's just like the flu shot needle. The risk of bleeding from that is really minimal. Just putting a Band-Aid is going to do it. So it does increase the risk of getting more bruising, I suppose, or some swelling, but very minimal, and certainly would recommend getting the shot over worrying about that concern.
Great. And we had a couple questions specific to sort of needles and the vaccine, like the physical administration of the vaccine. So I'll segue into those now. We had one attendee comment, I am okay with needles, but have a childhood fear that the doctor will stab all the way to the bone or a joint and cause permanent damage. Is this even a thing? Which I loved the way that was phrased. There's Paul's waving his hand. That was him.
Yeah, no, you'd have to have a really strong doctor or nurse to do that and hit you pretty hard. No, the people that are giving these shots are really good at it. Barely felt mine. They're really careful just to go through the skin and into the muscle. It's an intramuscular injection. Unless you're super skinny, it would be pretty hard to get down to bone. So that probably not going to happen.
All right, we'll lay that fear to rest.
Yeah, a little note on that too, for when you go in to get your shot, make sure you wear some loose fitting clothing that you could expose your upper arm. It's a small needle, goes into the upper arm in the muscle. So you got to roll that sleeve pretty far up. So short sleeves are best.
A perfect transition to the next question I had, which was, are there any other acceptable sites for the jab, like for example, a thigh?
Yes. So if there's a reason that you can't get the shot in the deltoid muscle, the thigh is the recommended alternate site. If someone's had surgery, or if they're on dialysis, or there's some reason you shouldn't use an arm, then the thigh is the recommended site.
Super. That's good to know. All right. And then, yeah, I mean, I know we've talked a little bit about the idea of these adverse reactions. One person wrote in to say, you know, a family member of theirs has read stories of people who have had adverse reactions, and, you know, it's made them very worried, and they don't want their 98-year-old mother to get the shot. And, you know, are there ways to address those fears beyond, like, well, we don't want them to get COVID, do we? Which she said hasn't really been effective in that conversation. Do you have any other things you would say to address those fears about that adverse reaction possibility?
Well, I think it's a balance. It's a risk benefit analysis. It's a balance of, you know, what are the risks? So the risks of the shot, there are very low numbers of complications from the shot and the immunization, so far as we know, in millions and millions of people having received it now. The risk of the disease, we also know. Now, you might not get it, and some people seem to do okay with it, but a fair number of people are getting blood clots and complications from the virus. A fair number of people are getting heart inflammation, myocarditis, and getting sick from the virus. Even young, healthy people. A fair number of people are getting very sick and ending up in the hospital from the virus. And a fair number of people, 500,000 plus, have died in the United States of the virus. So on balance, the risk of the side effects is worth taking when most people look at it, but I understand the hesitance.
Yeah, I mean, I think Joe's point he made earlier to the fact that like overwhelmingly people who are the most familiar with the science are comfortable getting it is maybe a good one there as well. But yeah, I think it's hard. It's hard for people.
Yeah,
just-
Hannah,
yeah,
just
go
I would punctuate that with to say if anyone has any questions about that, they should speak to their provider, their physician. And that's probably one of the best sources if there's any particular concern that they have, whether it be age or other illnesses that they might have. Their provider, their physician would be the best person to direct them.
That's great advice. Thank you, Joe.
Mhm.
Just to hit a couple more questions kind of in that same vein about, safety and who should get the vaccine. Maybe someone can speak to questions about if someone is pregnant or breastfeeding.
Yes, so this was a sort of controversial early on. There were not very many pregnant people in the initial studies. So the initial guidance was, as with everything with pregnancy, be super conservative. Just don't do it because we don't know. It wasn't studied. But the American College of Obstetrics and Gynecology, the National Midwives Association, everybody looked at the science and said, no, there's no reason that this should cause any problems for pregnancy or breastfeeding. So women should get it. And that went back and forth. And the current recommendation is, just talk to your doctor, talk to your OB, talk to your midwife, and understand if you don't get it, but they would recommend based on the science that pregnant women do get it. And there are more and more people getting it or getting pregnant because they didn't plan on it. And so there's starting to be some data and it appears safe.
Great. And what about people under 18? Is there any information about whether the vaccine is going to be safe for them?
Again, no reason to think it wouldn't be, but it wasn't in the original studies. And that's where a lot of these hard and fast rules came from, is just it's not in the study. So we can't say for sure. And so we shy away from making those recommendations. But maybe Bob, do you have a opinion on that one?
Yeah, I agree with you. And I've heard that I think it's either Moderna or Pfizer is opening up another arm of evaluation of kids down, I believe, as low as 12 years of age. So we'll have data on that pretty soon. But I would agree. There's no particular reason to think it wouldn't be effective. And we do worry about younger kids can get some serious complications from COVID. In general, they don't, but there's a rare multi-system disease that can be very serious.
Bob, thanks for chiming in.
Yeah.
And then kind of my last question for now on the nuts and bolts of the vaccine itself, but if someone's had COVID-19, should they still get the vaccine?
Yes, that is recommended. The recommendations on how long to wait afterwards have changed a little bit, but I think it's currently still, wait about 90 days, or you can wait 90 days, thinking that you have some immunity from the disease itself and having had it. But that's not a hard and fast rule, because the flip side of that is availability has been so low that the overriding advice is if someone offers you a vaccine, get it. So even if you've had COVID, we do recommend getting vaccinated to get the additional boost of immunity against it.
Great. So I think now let's transition to kind of some more logistical questions. We'll put Joe more in the hot seat. How about, Joe, can you maybe just speak a little bit to registration and, say someone's decided, okay, I'm ready to do this. What are the steps they have to go through? Do they have to register online? I know there's been some difficulties with people finding appointments. Can you speak a little bit to that?
Yeah, absolutely. And for Northern Light, there's two ways. One is in the best way, right? Go right to the northernlight.org website, and right on the homepage, there's a place to select the coronavirus vaccine, and that will take you to a page that will really provide really a lot of information about the vaccine and the process to register, and it will also give you where the appointments are available across the Northern Light system. So across all the places in Northern Light that are providing the vaccine right now, based on the CDC guidelines in terms of which cohort or group of patients that we're getting, it'll give you the appointment availability at those locations. And you can select any one of those sites where there's availability anywhere across Northern Light. And once you select an appointment that's available, it will then ask you to register for that appointment. And it'll hold that time slot that you select as you go through the registration process. And that's been an improvement. We've been developing this on the fly, and it's been evolving and getting better. So it'll lock in and hold that appointment for maybe 30 minutes or so. It'll take you through, and it only takes maybe 10 minutes or so to register. And then it'll lock that in for you, and it will lock in not only your first dose, but also the second dose as well at this 28 days later, for example, if it's Moderna, 21 days if it's Pfizer. And it'll confirm that and send you information, your email confirmation on that. So it's a really good process. Now, if you can't get through that process or you need help, there's a phone number to call, a helpline. And somebody will answer that line and take you through and register for you if that's what's needed. But that's the best way to access. So you have either the help desk line to walk you through and register, or to register online yourself.
And the frustration has been that we just haven't had the supply.
Yeah.
We open up appointment slots as the supply comes in. We get a supply once a week or so, and we don't know what it is until we open the box. So if you open up a slot, if you open up 10 slots, 40 slots, 100 slots, and there are thousands of people waiting for them, you're going to end up with a lot of frustrated people. And no one is, well, I won't say that. We're very frustrated by it too.
Yeah. I mean, that's been the meter, right?
Yeah. And I would just like to point out that some other people on the call, Ann and Janet and others, have set up other helpers who can help people through this process and help people register, help people get the appointments, and help get people to the appointments. So working with Healthy Peninsula and others, there are other resources. The communities come together, realizing this is a frustration, realizing not everybody is tech savvy, really not everybody has great access, to try and make it easy. So we'll certainly do that in the clinics and the hospital, but our community partners are doing it too.
Yeah, you took the words out of my mouth there.
Yeah, that's the tough part. Exactly what Mike said. And so right now, the appointments, we learn Monday morning how much vaccine we're going to have for the week, and then we open up the appointments from there. And then if there is some additional vaccine that's allocated to us, we'll know on Wednesday morning, and we can open up appointments from that. So that's why the Monday and Wednesday, we've taken the approach at Northern Light to not create a waiting list that folks wouldn't know. So with Northern Light, when you find that appointment availability, exactly. You don't have to look at other sites or register for others. You lock in that appointment and go forward. There are other health systems in the state that have gone a different approach where they're creating a wait list. And you would go on and register and put yourself on a wait list. And I think that there's pros and cons to both ways. I think some of the challenges with the wait list is you don't know when you're going to get called back, and there's thousands of people on that wait list. So it's frustrating for those folks as well. So those are the two ways that we're doing it. And with the Northern Light website, as I mentioned, you can look at any one of the sites. You can go down to the Cross Center if you can get there, or you can go pick a site locally. As of this afternoon, for example, I went on the site prior to this call just to see if there were any appointments available, and there were appointments available for over 70 at the Cross Center. and one other site in Maine, in Presque Isle. There were a number of appointments up there. I realized that's far for us, for this community for sure, and we'd hope to be able to accommodate you right in Blue Hill, and we're working hard to do that. We, just to give you a sense, we're doing about 175 to maybe 200, per clinic at Blue Hill. We'll do it a couple times a week. When we have, as Dr. Marnick said, when we have the allocation of vaccine, we can do maybe 3 times a week. We'll do around 150 to 200, somewhere in that range based on the supply, 3 times a week. If we get extra, we'll run an extra clinic. And we're doing about the same number at Maine Coast Hospital as well. And that's based on the supply that we've had. And it's, we'd like to do more. And every day we're looking at a couple of things. Creating a larger site off campus where we can scale up more once the vaccine supplies come in. We're also looking to work with partners that can get us access to some of those folks that would have trouble getting into one of the sites, and we don't want to miss them as well. So we're figuring out ways to work with the community in those particular areas. So it's just a little bit more information on what we're doing.
And the distribution of vaccines is kind of interesting as well. The vaccines are developed by the pharmaceutical companies, but it's owned by the federal government. They're the one that bought it. So it belongs to the federal government, not us. It's distributed as far as the states. And then the state is trying to be really fair in getting it everywhere, which leads to some odd assignments because there isn't enough vaccine to go everywhere the way we would like it to. So they are trying to make sure that enough gets to Portland, enough gets to the county, enough gets to underserved and minority populations, enough gets to rural areas, which means that they're getting their allotments similarly. Theirs arrive and they don't know what they're getting until Sunday or Monday or Friday, and then they divvy it up, and it's delivered to the Pfizer. Well, actually, I think it's all delivered to the deep freezes at the big centers in Portland and Bangor. But it's the state that distributes them. So we move it around, but we move it where the state tells us to. And so that's why we don't know what we're getting until Monday morning.
Actually, the easiest part of the whole thing is putting the shot in the arm. That's the easy part. It's matching, it's getting the vaccine supply, knowing when we are going to get it, opening up those appointments right away so we can get people scheduled, right, and do all that registration and getting that locked in, and holding a second appointment for them, the appropriate time afterwards because of the second dose coming through. So the logistics around that are a bit complicated, but the really great thing about what's happening in Maine is we're using up 90% of that vaccine the week we get it. So there's nothing sitting on the shelf. And from what I understand nationally, that number is around 60%. So overall, that 60% of the vaccines that are allocated or provided during that week, we're doing it at 90%. So, we want to do more and we want to scale more. And I think we're getting in a position to be able to do that. But just to give you that background.
That's so helpful. While we're talking about distribution, I had a question sent in about reaching homebound people. So, are plans being made locally or just at the state level or just at the Northern Light Central level? And are you reaching out to local community organizations to help? We've heard Dr. Shaw and some other folks talk about the area agencies on aging, which is great, but they all have huge service areas. And can't possibly serve all the older people in those areas. So what's the plan for trying to get to folks who can't get to the vaccine clinics?
Yeah, so the answer is yes and yes, and we need to do more. So we have Northern Light at the system level is using their home health agency as well as our hospice care, and they're using those folks to get out and provide vaccines in the homes. And that's increasing with supply as well. So absolutely a big focus there. Locally, we need to do a better job working with community organizations to be able to reach those people as well. And as we start to scale, that's one of the areas we want to focus on.
right. Bob, since you've got your hand up, why don't you jump
just-
in?
Just jumping on that one, Joe, I just wonder what opportunity and need do you have for community volunteers helping to work some of your clinics, especially if you got a bigger site, say in Ellsworth, or if you
Yep.
need more with a Homebound?
Yeah, thanks, Bob, for that question. Absolutely need volunteers. We can't do this without volunteers. We're putting the group together right now as we expand beyond the folks in our local clinics within our hospitals. And it's exactly as Bob said, as soon as we get out to a site off campus and we want to be in a position that we can scale rather exponentially, we could not do that without volunteers. So we have a growing list of folks that we're putting on, and certainly you can reach out to us and to Kelly, and we'll definitely take on as many volunteers as we can. Critical part of this process. Thanks for asking that. Both, and Bob, not just clinicians. We definitely need clinicians as well to administer the vaccine, but the coordination around just making sure, folks with being able to help push wheelchairs and help people in and out of cars and parked cars and all the coordination to make sure everyone's socially distanced, appropriate distance apart. Those things takes a lot of people to do that. We're estimating that for every vaccinator that we have putting shots in arms, we need about 6 people to help with the crowd management to get people to that vaccination. So yeah, big part.
Big group effort.
Yeah.
Let's see. Anne, why don't you go ahead and ask your question, Anne Troth, and then I see Carol, you've got your hand up, so we'll come to you. And I know Janet had a question, so we'll do a little round of audience questions.
So thank you. So I'm Ann Schroth. I work at Healthy Peninsula. And one of the things that we have been concerned about is, it was great to see the speed that people at nursing homes or retirement communities got. The independent pharmacies helped out. But where the place I don't see that happening is the low-income senior housing communities. And we have 3 significant ones in this community, and they are often as homebound, but they get less services, fewer services, which makes them even more at risk. They have a hard time getting transportation a lot of times. They can't afford broadband or all the resources they need to get online. I reached out to the independent pharmacy that did Parker Ridge, for example, to see if we could help them go start doing those communities when they got done with Parker Ridge. And they were told by the state that instead everything went to Walmart. And so these people can't get to Walmart anywhere than they can even get to Blue Hill. And so I'm just wondering if there's any plan to, I know Dr. Shaw says people who are homebound should stay home while everybody's out in the world gets vaccinated so they don't catch it and bring it to them. But at the same time, I'm wondering if there are visions for these places. Thanks.
So yes, we don't have solid plans yet, but we very much want to expand and get farther and farther out the network to those people. The pharmacies got special allotments to go into the nursing homes and group living situations, and those sort of unaffiliated ones didn't get included. Certainly home health could get in there. If we can get out to the clinic level, that some people can get into the clinics. If we can have more community level stuff that could get to some of those people, or we have to organize a way to get in there and do a local vaccine Saturday morning at maybe that site.
Yeah, we would love to do that.
Right.
I think and maybe if the 1 dose one would be easier and doesn't have to be so icy cold and stuff. But it's just a shame that the efficiency with which they got to places like nursing homes and retirement communities didn't happen at that level, which is I would say just as necessary. And some low-income senior communities did get it. I heard with independent pharmacies in the southern part of the state. And I don't know if it's because of volume and it's all about throughput. And I know, and they're small. But if you put them all together, they aren't that small. If you get a van or something. So anyway, we're here to help if we can.
Appreciate that. And yeah, it comes down to supply. I mean, that they got an allotment to do that, and that's what they got. So, and given that not enough supply, we're concentrating it where we can handle it right now while we develop the plans to get more elaborate and get out and hope for more supply and more vaccines to allow more flexibility as well. But thank you for bringing those up. We haven't forgotten them, but we haven't gotten to them yet either.
Yeah, and it keeps reminding me about how we all want to get out there and get everyone done, and it's going to take months. But we think about, 8 weeks ago we didn't even have a registration system, and so that's been built, and we've already given out thousands of doses, and we continue to learn as we go and get better at it. And we've got to absolutely reach out. One of the other concerns were the folks that live out on islands that, they're very isolated, and how are we going to get to them as well? So there's a lot of different avenues that we all need to work together on. So I'm really happy, and I got to even meet you through this forum, and we should definitely connect so that we can figure out a solution for those folks that you mentioned. Absolutely look forward to working with you on that.
Great. Carol, I saw you had your hand up earlier. If you want to unmute yourself, you're welcome to ask your question now. And
yes, this question, I've been raising my granddaughter since she was 4 years old. She's 25 now, and she has a brain injury. So my concern is about neurological damage from a vaccine, or some of the components, for instance, something like mercury in a vaccine or something like that.
Yeah, great question, and a big concern to a lot of people. One of the amazing things about these vaccines is how simple they are. There's really very little in them. There is no mercury. There's no preservative. That's why they're frozen. It's very limited ingredients. It's the mRNA, and it's the fatty capsule that's like a cell membrane that's around it. And that's basically it. Haven't seen reports of neurologic damage from that. And in fact, there hasn't been mercury in vaccines for quite a long time because of this concern, although that also hasn't been borne out in the literature. But as far as these vaccines go, there's no mercury in this, and very little concern for neurologic damage.
thanks, Mike.
That said, we're also still trying to figure out how to distribute it, and we don't have enough. And Maine so far, or other states that have tried to add sort of a predisposing condition, another illness, another reason to get the vaccine that makes a lot of sense to all of us, haven't been able to figure that out. Do you need a note from your doctor saying that you really have diabetes or COPD, or how do you certify that, or how do you keep people from gaming the system? So far, it looks as though Maine is just going to go down through the age ranks and hope that the supply comes in and we just get everybody without having to get too complicated about pre-existing conditions and predisposing conditions. But that may change. We'll see.
Thank you very much for coming on and doing this. I had questions and no place to go with the questions.
Oh, no, thanks for having us. This is great. We love doing this.
Thanks, Carol. And if you have more questions, just wave again and we'll call on you again. Janet, you mentioned you had a question you wanted to ask. Let's turn to you.
Okay, great. Thank you. This is really nice. I like to hear folks from the hometown. Seems more informative than listening on the corporate level. I don't know why, but it's reassuring. My question is a little bit more basic in regard to the risk statement when we're talking to folks, which has really been a nice thing. And I would say that we've enjoyed having the system improve over the few weeks that we've been helping. So I think it's much better. But what I wanted to say, the question I have is in regard to the difference between the emergency use authorization, EAU, from the FDA, and not having full FDA approval. I had a person ask me today, like, what does that mean? And I don't know what's the difference? And of course I referred them back to their provider, but I wondered if someone could just speak to, like, what's the leap from an EAU to a full FDA approval status?
Yeah, great question. And there are little sort of interesting legal offshoots that come from that. And I'm not an expert, so if anybody else knows more detail, feel free to jump in. But an emergency use authorization is so that we can get something into use and start using it early before it has to go through the full FDA approval process, which can take months and years usually. So it hasn't gone, they haven't done the longer term studies. They haven't done the studies in the smaller populations, the pregnant women, the kids, the whatever other small populations you want to study, and immunocompromised. So they don't have all the data in front of them to say, yes, this meets full FDA approval standards. But so far what we have with millions of people looks really good. And we're faced with this dread disease that's a global pandemic. Let's use it. So legally, there's a couple of funny things like that. Like people ask John all the time, are you going to force me to take this? And because it's an emergency use thing and not FDA approved, you can't force anybody to do that. Nobody can legally be forced to take this, which I thought was kind of interesting. As Joe pointed out, people are signing up, and 90% of us have willingly rolled up our sleeves to take it once we studied it. I had another interesting twist in mind because of the EUA, but I can't remember what it is now. So it's basically, it's preliminary approval, basically, and it looks like it will be approved. So far, all the data that's coming in has been very supportive, but it hasn't quite passed all the hoops yet. Bob, no more? You're muted.
There you go. No, that's great. And I think the other reassuring thing to me is that if you look at all vaccines, that most serious adverse effects that have been described in history have come on really quite quickly rather than long-term. The seizure complications, the neurologic complications from DPT, and others. Usually it's within the first, a month or so that's seen. And this has been studied, as Mike said, the original studies over the whole year with, at least I think it was 40, 50,000 in each of the two vaccines. And now, as you say, it's 50 million doses have been given out, I think is the latest report. And there have been, I'm rather amazed as a physician, there's been literally no longer term or more serious side effects described besides what Mike has mentioned. So I think that's very reassuring in itself that, it's very unlikely that there's any sort of long-term untoward effect that we didn't anticipate, especially where the vaccine is so simple with so little additives.
Thank you.
Did that answer your question, Janet?
Yeah, I mean, I think we certainly don't pretend to be doctors, so we just would refer people back to their physicians for those big questions. But I mean, we are going through the risk statements with folks when we're getting them registered and making sure that they have acknowledged that they've received the information, like Mike said earlier. And it's just kind of helpful to know. I had no idea when the woman asked me today, like how far was it from A to B? And I have a better understanding. So thank you.
I had a few more questions that folks had sent in ahead of time that I want to make sure we get to. Going back to kind of the question of registration and all those logistics, someone wrote to say their primary care is with Bar Harbor. So they did register on their wait list. And they had questions about where does Bar Harbor get their vaccine from? Is it straight from the government, or does it come through Northern Lights somehow? And, once I get through their waiting list, will they send me to Ellsworth or Blue Hill, or will I fall through a crack if I don't register somewhere else, even though they say not to register on multiple lists? Can you speak to any of that, Joe?
Yeah, sure. And it actually gives you a good example of the challenge with the wait list is kind of sitting on the wait list in this limbo and you don't know what to do. And so anyway, the CDC, the main CDC allocates the vaccine. Now, whether they send it through refrigeration and freezers, through different health systems, through Northern Light, it's directed by the main CDC. They call the shots on who gets what. And so it's that's the thing that we learn about usually on sort of the last minute, if you will. And so all ships rise with the rising tide. So as this the vaccine amounts are increasing, and they're increasing substantially next week. We heard today from the CDC on that. They expect the 38,000 doses coming into Maine for next week, which is really promising. It's the most that we've had so far. And but with that said, someone that's on a wait list, if they could continue to try to find another appointment somewhere else. But the important thing would be if they do find another appointment and they decide not to go to that MDI resource, if they were called for that, they should really cancel that appointment so they could take themselves off that wait list, so it would make room for someone else to be on it that would be called sooner. That would be my recommendation for that.
So just if I'm understanding you right, you're saying the MDI hospital gets their allocation straight, like from the main CDC.
They're
not affiliated with Northern Light. So it's two separate systems.
Yeah. Northern Light's not, but as Mike said, Dr. Marnick said earlier, all the vaccines owned by the federal government, directed by the CDC. So they're calling the shots on where it goes. And Northern Lights may be handling if it's sent to our freezers and we're told to allocate it to a different site. That those calls are made all the time, and they're based on the data. They want to actually send the underserved areas that, they'll look out across the state and see where the highest risk of COVID is, and we'll send a vaccine to those communities based on their decision criteria there. So lots of data is being done. You can hear Dr. Shaw talk about that as they make those decisions to allocate the resources that they have. But again, once someone's on a waiting list, they would appreciate if someone would call and say, hey, we're no longer on this waiting list because we got the appointment at a different location.
Right. So MDI is just going to say, we'll go through this waiting list until there's vaccine available here at MDI.
Right.
They're not going to call you and say, hey, we don't have any here yet, but you could go to the Cross Center. You would have to kind of do that, check out that other option on your own, and then call MDI back to say, I don't need to be on the waiting list anymore there.
Yeah. And that's how, yeah, go ahead.
Yes, I mean, that gets back to that, Maine trying to be fair and distribute things. MDI is an independent hospital, one of the few sort of independent hospitals standing on its own. And there was a lot of concern among some that, hey, all this vaccine is going to go to the big 2 or 3 health systems in the state. What about all those independent hospitals down east and MDI and some others that are scattered around? The state wants to be fair, so they're sending some directly to those smaller hospitals. So MDI is getting vaccine. They seem to be doing a nice job getting it to as many people as they can. They get the same, drive. They want to get shots in arms, but they're registering people, and that leaves you waiting. You don't know when their supply is going to come in, when they're going to get to your name on the list. And as other things open up, people are going all over doing some crazy things to get their shots. I heard a story of from someone up in Dover Foxcroft that someone from Texas had registered, flown to Portland, and jumped in a car. And then, unfortunately, drove to Dover, New Hampshire, and was really lost and called because they were afraid they were going to miss their appointment. But so don't do that. Stick close to home. The vaccines will come, and we'll take care of you.
Great.
Yeah.
Paul, did that answer your question there? Good. Okay. Thumbs up. To circle back, did you have more to say on that, Joe?
Yeah, I just wanted to share that we do talk to MDI too, and other organizations around the state to find out. We have lots of conference calls to figure out what's working and what's not, and we share best practices and understand how to speed it up. So together we're getting better at it. And we just want to share that we're not working in isolation with it.
Yeah, I think the way that everyone around the state has been handling this crisis is a real testament to cooperation. Okay, just circling back to a few other questions I had on my list. Can we talk a bit about kind of what comes next? So we've been talking about folks who are in that 70 and plus range who are eligible for the vaccine now. What about the rest of people? What information is out there about, when the next groups are going to be available? What are the next groups? is there going to be enough for everyone?
Yeah. Yeah, there will be enough for everyone. It's just going to take months. It's going to take longer than anybody wants to realize. And but that's, you know, based on how fast the supply increases. So the next group to be vaccinated will be the group we believe over 65. So they'll expand upon the current group, and it'll be similar in terms of not prioritizing based on other illnesses. It'll be straight open, anyone over 65, that'll be the next group. And I believe the Maine CDC is working on that decision on when to make that open. Right now, they're juggling between the fact we've gotten through most of the over 70 crowd, but as Ann had suggested earlier, there's still a bunch out there that we haven't been able to get to. So we've got to weigh out making sure as the CDC opens up the 65 and over, it doesn't make it tougher for those that are over 70. And I think they're working on that decision when to make that available. But with the news of a large increase of supply coming next week, that's really putting that decision on the front, you know, sort of front of their mind in the CDC. And they talked about it today. So we hope to get to that group real soon.
Great. And then let's talk a little bit about after people receive their vaccines. I know there's questions out there about like, okay, I'm vaccinated. Now, what does that mean for me? Do I still have to wear a mask? Can I have friends over for dinner? Like, everyone's very eager to get back to, you know, real life. So can either of you speak a bit to that?
Sure.
Yeah.
You know, it is a good feeling to be protected. I was able to travel when I had to last week, but I wore my mask the whole time. And we are at a really delicate place where most people are not vaccinated yet. And we've got new variants showing up, new mutated strains. When viruses replicate, they replicate fast, and they're replicating by the millions, and it's clearly spreading. They've found a great host animal in humans, and every time there are little mistakes made and they mutate a little bit. So there's new strains coming up. We've heard about the South African strain, the British strain, now the California strain, the Brazil strain. We have some homegrown US strains now. So it's still circulating fast and hard, and we don't want any of these new ones to get a foothold. So we have to really keep doing those basics. Wash your hands, wear the mask, keep the distance, even after you're vaccinated. A lot of these vaccines are mostly designed to keep you from ending up in the hospital with severe illness. Doesn't necessarily mean you won't get it. Doesn't necessarily mean you won't carry it. So that's a concern that you could be vaccinated and carry it around without getting sick and maybe spread it around. So until we get most everybody to that herd immunity, we still have to be careful. Hopefully it will start opening things up, but just not yet, not probably till late summer. So keep wearing the mask, keep washing your hands, keep the distance.
Yeah, it's like another weapon in the arsenal. You know, we have our masks prior, and we have washing our hands and social distancing, and now the vaccine is just one more tool in that toolbox to protect those and protect yourself and those around you.
Great. What about like the idea of having proof of vaccine, right? You know, are people going to ask for that? Is there some kind of system in place of like getting a record of that? If it's just like a little card you have, you can lose
Sure.
that.
Yeah, so right now there's a card that you will get at the time of vaccination. They're like showing his right there. It's official. And there's a QR code and a barcode on it, and a date when you were vaccinated, and also what kind of vaccine you received. And that's a good thing to carry around. But Mike, I don't know if there's any real further development on that. We'll have a record. Yeah, at Northern Light, we'll have a record of the fact that you've been vaccinated as well. And we also we let the state know, so the state has a record through their system. their impact system?
Yeah, so it is, it's a great question, and it just hasn't happened yet. So much of this is happening on the fly and being built around us as we go. There's a lot of talk of, will that card that I just flashed with the 2 stickers on it let you go to a different line in the airport, let you get into a restaurant when someone that doesn't have it can't? I mean, there's real concern about disparities there. But some of them, some of it makes sense. Who's vaccinated might take longer, screen longer, do more screenings. If you have the card, maybe you don't need to do that. But it really hasn't. We don't have enough science to make those decisions well, and we certainly haven't put policies in place yet. A lot of the CDC rules haven't figured out, that other category. If you're vaccinated, you can do this. The one that's come out is if you're vaccinated and you're a close exposure, you don't have to quarantine as much. But it hasn't really gotten into travel rules in most states. I think Rhode Island has something about vaccinated people now, but it really hasn't come out yet. Those rules and recommendations haven't been made yet. They may come, and they deserve a lot of thought because there's potential for real disparities and problems with them too.
Yeah, it's like it's all evolving, right? I think that's a good way of saying it. Even everything is, right? The vaccine, the rollout, the development of that, as well as what are they going to do with the information that you have been vaccinated. So,
and a big part of the link is this, as Joe mentioned, is the state impact, IMMPACT, vaccination registration that we use for vaccinating kids is linking all the COVID vaccinations now. So we're reporting to that state program. And so that's all, it's collected in a place, and that's where they're getting some of their data from.
mm-hmm.
And here's a quick one that maybe quick, that I probably should have asked earlier, but does getting the vaccine cost any money?
Great question.
Yeah. Yeah, there's no charge for the vaccine. The vaccine's provided by the federal government. There is a $35 charge for the administration of it. So that's a charge that all providers are using to staff the clinic. We're not making any money on the vaccinations. It's not even nearly covering our costs, but it's a fee like a flu shot administrative fee to be able to give the vaccine. So,
but that's also been quite clearly stated that should not stand in the way of anybody getting the vaccine. If someone doesn't have the $35,
well said.
Not a problem. Our goal is to get shots into arms.
Right.
If we can recoup some of that administration fee from insurance or something, we're happy to do that. But it is not, that administration fee is not a barrier. If you need the shot, come
you get it.
The shot.
You get it.
And I actually talked to compliance today, and that administrative fee is not supposed to be passed on to the patient, even in non-insurance situations. So, so I know we're working on that. We had someone show up with a bill to their second vaccine from their first, and we are figuring that out and taking care of it. So, so that shouldn't happen. We're not expecting that to happen, and should just be a non-issue for on the patient side.
The insurance companies are saying they'll pay for the vaccinations for those that are insured, and during the registration process, we'll take insurance information. But as Kelly said, it's not being passed on to the patient.
So it's typically being covered by the insurance if you have insurance, and then if not, don't worry about it.
Exactly.
And did you have a question about that?
This, at the risk of criticizing the wrong people, I will say that the registration system is designed by the person who wants to collect the insurance information. And if you really want to make it efficient to get people in and get shots into arm, then your system will be name, birth date, where do you live, how, and get them in there, and then collect their insurance information after in the 15 minutes, say. But the system is complicated for people who aren't tech savvy. I know it's really fun and easy, and it's like winning the lottery for us when we get people in, but it's really not that fun if you're 85 and terrified and so anxious that you cry on the phone with a stranger. And so it's not, it's clear, the system is so clearly written by somebody who wants to collect all the necessary Medicare data and information to get covered. And I think you should get paid. You guys are doing amazing work, but there has to be a better way to get people who are on the edge of being tech savvy enough to get into that system, because right now it's not really working.
Yeah, no, it's incredibly frustrating. And the other complaint we hear is, hey, you guys have all this information for people that are our patients. They're like, look, I'm in your computer with all those numbers. I got to look them up. I got to find them. I don't know what they are. Why don't you just pre-populate it? Well, it's because it was built because we have to serve everybody. We got to get everybody this vaccine.
Right.
We got to get the people that are outside that we don't know, that aren't our patients. We got to get them in. So it all has to be forward facing, patient facing. And so that's why it asks for all that information. But it's very frustrating, and hopefully it'll continue to evolve and get better and smoother. But that number of 6 to 8 people for every person doing shots at the vaccine sites right now, our bogged down point, our bottleneck, our slow point is the observation afterwards. If we had to do all that whole registration and insurance stuff up front, we worry about people bunching up and being too close. Too many
But they
people.
could just fill out a form then, or you could call them after or something. I mean, there must be a way to make the complicated part also the part that people have least access to. Is tough. It's tough, and I know like 54% of people over 70. That's a good number. But what about the other 46? And they're trying. They don't know that there are people like us around to help. And I'm just thinking about the people who are going to end up not getting it, and then there's going to be another rush when 65 to 69 opens up, and it could be a really simple make a reservation for dinner type system, and then there could be a follow-up later, especially if there isn't that much, especially if you're still going to give the shot to the person even if they don't have the $35. So I'm not saying you shouldn't get paid, I'm just saying there must be a better way.
No, there's got to be a better way. I agree with that.
Yeah. And with feedback, and I hope we'll get there. We'll continue to evolve.
Thanks, Anne. I mean, your on the ground experience is vital. Anne's going to come tomorrow to a Zoom staff meeting for the library to help train us and how to help sign patrons up for vaccine appointments. So
yeah, she's doing this all day.
Well, I can tell.
That's what worries me, because I'm not doing it all day, and I'm worried that people aren't. I mean, maybe it means people are getting a lot of help elsewhere. That's great, and that's really great.
No, I agree. I mean, we do get patients that show up and have confirmed appointments, and the registration isn't correct, and we have to redo it on the spot, and it really slows the whole clinic down. So you're right, Anne. We got to continue to improve, and we will. Thanks for the feedback.
Let's see. One other question I had on my list was, what happens if someone chooses not to get the vaccine? Open-ended.
Yeah, I mean, there are no repercussions on that. It's just putting yourself and others at risk. A lot of these efforts have been to try and keep our health system from being overwhelmed. The personal health benefits are there, but we're all really looking at population health, which is a tough thing for a lot of Americans to get their heads around, I guess. If you don't get vaccinated, there's no repercussions unless we get to a point where people that are vaccinated get to go places where people that aren't vaccinated aren't allowed to go. I don't really see that happening, but it's a concern. You have the potential for catching it. You have the potential for giving it to loved ones. You have the potential to give it to strangers. On balance, I think the risk of the disease is a lot worse than the risk of the vaccine. And so I would recommend getting the vaccine, but it's a personal decision to put something into your body. And I understand people's hesitance, but I would strongly recommend getting vaccinated. And it may be that we all have to get vaccinated again. The coronaviruses typically don't give lifelong immunity when you get them. It wanes, and it may be that we have to get another COVID shot every year, like we have to get a flu shot every year. And there are people working on a combined COVID flu shot already, in case that comes to pass. So you might get another chance. And we're seeing that a lot too. A lot of people that initially were hesitant, decided against it, are now saying, okay, now I've seen millions of people take it. I've seen my family members get it. I've seen my coworkers get it. Sign me up. I'm ready now. So you can always change your mind.
Did you want to chime in on that, Bob?
Well, yeah, I think it's a great issue, great question. And I've heard, we have some pretty strong anti-vaxxers in this community in Blue Hill. And, from a healthcare and public health standpoint, the question is how can we best help people that have strong concerns, strong worries? I think this kind of a setting forum is just a great way is to be able to present just in a nice interactive way the science from people who really are steeped in the science. I think some of the extreme anti-vaxxers, there may be nothing we can do to try to convince them otherwise. But I'm always impressed by the statistics that the majority of the cases in Maine are 20-year-olds. Now, they didn't get very sick, but they very likely passed the virus on to others in their family, and most importantly, maybe to an elderly person. But it's the 20-year-old population that are actually most at risk for catching the virus and carrying it and passing it on to other people. I don't think in general they believe that or realize that.
It was
Some of them are getting
interesting.
quite sick. Go ahead, Scott.
I had two questions, but you're on the subject of one of them. I feel unfortunate enough to be reasonably healthy and not old enough to be, anywhere near the front of the queue. And now Bob's talking about vaccinating, 20-year-olds. So I'll get totally sandwiched out. But I guess my real question I'll ask both of them together. If you listen to the national briefings, there's a huge amount of discussion, and we've heard it here tonight about how to overcome resistance to getting vaccinated. And we've also heard the president and others say, the real bottleneck is vaccinators. We need more vaccinators. And I haven't heard, so from my perspective, I haven't heard you guys say that vaccinators are a bottleneck. I mean, as far as I can tell, there's only one bottleneck, and that is vaccines, doses. It feels like we have, a comfortable number of vaccinators. And it seems like, at least in Hancock County, the current demand for the vaccine vastly outweighs supply. And so I guess my question is I'm a little frustrated that we spend so much time trying to gin up even more demand for vaccine by holding people's hands and saying, it's really safe and you should be comfortable and so forth. I kind of get it, but I'm surprised that the strategy isn't to accommodate those who want it. Again, I'm totally fine with the age-based or whatever comorbidity type decisions. I don't mind being at the back of the queue, but I'm surprised we don't spend more time just kind of vaccinating those who really want it. And my assumption is, by the time if you keep it open to 70-plus-year-olds, again, as somebody just said, once you've seen, all of your friends or 90% of your friends get vaccinated and they've been just fine for 3 months, my guess is a lot of people who aren't stringent anti-vaxxers are going to say, you know what, maybe I should just go ahead and do it. And the demand will come along. So it feels like the PR campaign is oriented in the wrong direction. I guess my local question is, do we have a shortage of vaccinators? Is that a real concern? And then the second is, do we see lots of pushback from people who are eligible today to get the vaccine, who are saying, no, I don't want to? is the 46% that Ann mentioned. Are they saying no, or are they just unable to, either waiting for an appointment or unable to, because of technology and phone and so forth, frustration over the registration system, they want to get the vaccine but haven't been able to do it. So what's the local experience been?
I probably a bunch of us can jump on this one with ideas briefly. I mean, I think my impression is our problem now is supply. We've got lots of people that want to be vaccinators. We've gotten when we vaccinated the community healthcare workers and others, almost to a person, they offered to volunteer and come back and help do more vaccines and shots. The community response has been great, and the feeling in those clinics is really, really nice after a year of being ground down by this pandemic of positivity, enthusiasm. It really feels good to be doing this. So no, we've got lots of vaccinators, or I think enough for the area. If we could just get our hands on enough vaccine, we are flooded with ideas for how to do this. We can do it outside in drive-throughs, to do it in abandoned shops, to do it in the hospital, to do it in the clinics, do it in homes, do it everywhere. So I think you're right that at least locally, that's not the bottleneck. That's not the rate limiting step. I think the PR is in response to the mixed response we've had to masking and the other simple public health responses of wash your hands, wear a mask, make me. I think they're trying to sell those people, no, please get vaccinated. That's how we're going to get back to work. That's how we're going to get back to school. That's how we're going to get back towards whatever normal is going to be 8 months from now. So I think it may be out of line with where we are on the timeline, but again, things are evolving fast and it's messy.
Yeah, but there's no shortage of demand either, Scott. So it's supply, purely vaccine supply. Get us more vaccine, we'll get more shots, more appointments. It's all driven by that. We'll have plenty of people to give the vaccination.
If I can ask just one quick follow-up question on the same subject. You guys have some insights in terms of the local population and their views on vaccine. And I guess I'm curious vis-a-vis, the mythical herd immunity. Is this a community that like if you look at flu vaccines, at the propensity to get that, will we largely get there based on people who are already flu vaccine recipients, or do we need to push harder because this is A, new, but B, maybe more deadly is probably the wrong word, but impactful on people's lives.
Yeah.
Flu has been.
Yeah, I tell you, it's the population that Bob's referring to. It's 20-somethings, right? The younger folks that are not even wearing masks. It's going to be hard to get them to be vaccinated. So to really get to herd immunity, we've got to get that population vaccinated, and they'll be the ones that are most recalcitrant to taking the shots. And we see that. I mean, we look across our own. We have great insight to our own population of our own employees, and I think that's interesting that there is a cohort that is not as accepting to that vaccine, and that are not real stringent anti-vaxxers. But there's a younger population that would just not stand up for it, not come in and get it, and we work to educate them.
Thank you.
Mm-hmm.
Does anyone else who's, oh yeah, go ahead, Mike.
I was just saying, there's a formula for what percentage of the population you have to get immune to achieve herd immunity, and it depends on the characteristics of the virus. And we should be learning enough about this that that number should be getting clearer, but it ranges from 60 to 75%. Is what I've heard, but I haven't heard a recent number. Bob, have you heard, or has anybody heard what percentage we have to get to be effective? And it may change with the new strains and variants too, because they have different infectivity numbers, coefficients. So it may change.
it's increasing, right? The
It would
percentage.
probably increase it, yeah. And yeah, so with our population, the US population, it's hard to imagine getting that number without a lot of education.
Did anyone
But it'll
else
get
who's-
better.
Yes, it'll get better,
It'll get
which
better.
is good. I just wanted to check if anyone else who's on the call tonight has more questions that we haven't gotten to yet. I've got probably one more I could ask on my list, but want to give anyone here first dibs to either type something into the chat or wave at me and we can have you unmute and ask. Going once.
I'll just say that in terms of reluctance to get it, and I wouldn't necessarily know about the people who don't want to, but the people who I've worked with who have been able to get it, including some of our people going to people's homes, have been so grateful and feel so lucky and are so willing to come and help and do whatever you need and bring you lunch and whatever. They just feel like they are just so grateful. I mean, I feel like the pent up anxiety is really, you could touch it. And so everyone who gets it is so grateful. So I would say all I see is the like willingness, desire, eagerness to get it. And so, you know, thank you. I know I'm here criticizing you, but thank you for everything that you're doing.
Yeah, I'd add on to that as a now relative outsider. The experience that my wife and I had at Blue Hill was just phenomenal. Our second vaccine is tomorrow. I was called twice today by different people, maybe a little overboard there, but the personal attention, I mean, it's just such a contrast, you know, to what you see on television with people lining up, even up at Eastern Maine. They were lining up in the cold outside the hospital, I understand, but hats off to the job you're doing here in the Blue Hill Ellsworth area. It's just really impressive. The personal aspect to it is an extra bonus that I just hadn't expected such personal attention from all those 6 people that we saw. So please pass that on. Yeah.
Yeah, they're very dedicated to what they're doing. It's a great team.
Well, the one other question I had heard that I wanted to kind of throw at you guys before we wrap up tonight is around feeling sick, especially after the second shot. You know, I've heard people sort of saying, oh, everyone I know has gotten sick after the second shot, or should I plan to take time off from work after the second shot? Do you guys have anything to share about that, about what people should expect in terms of like feeling those symptoms after the second shot, particularly?
Yeah, I don't know percentages, but it seems to be all over the place and a little hard to predict. My arm was sore after the first one. It was probably 3 times as sore after the second one, and it was sore for a couple of days. I felt a little tired and went to bed early the second day, but it took about 6 hours before the arm got sore the first day. So I finished a shift and then went home. I had other people with shaking chills that felt sick and couldn't have worked and stayed home and went to bed, but that seems to be a really small number. Other people would say that they didn't feel a thing. So I would say, if you can make arrangements to potentially take the day off, you might need it, but you probably won't. Most people are doing okay. Don't take ibuprofen or Aleve before to head off those side effects. It's okay to take them hours later if you're feeling bad, but don't take them ahead of time is the recommendation now. But almost everybody 48 hours later, they say, oh, it's like they flipped a switch and it's all better. So it's definitely worth going through that time of your immune system kicking in to get immune. And it, 94, 96% chance that you're relatively immune to this thing. So.
And I would just add, it self-resolves. In all the cases I've heard of, we've vaccinated hundreds of our own employees and thousands of people out there. All of the side effects that Mike just described, self-resolve within 2 days. So if someone's feeling really bad, they'll be better within 48 hours.
Just gotta wait it out.
Yeah, it's gotta wait it out.
Thank you. Thanks for answering that one. Yeah, I just want to echo everyone's thanks to everybody. I mean, I've heard universally positive experiences from people, whether they're in Blue Hill or even up at the Cross Center, that people just say this is all, there's some complaints about the registration process, as Anne mentioned, but once you get actually in there, everyone says that it's just working super smoothly. So I commend you for the work that you've been doing. And thank you again for coming out here tonight to answer questions from our community. I just want to reiterate to folks, if you have further questions after this, feel free to contact me here at the library. Our job is to answer your questions and to get you quality, trusted information about anything you're looking to find out. So if you go to bed tonight and you wake up tomorrow and you think, oh, I wish I'd asked this or that, send me an email, give me a phone call, and I will work, with Kelly and with others to make sure that we get you accurate answers to any questions that you have. And again, I will recommend Healthy Peninsula as well as other organizations in the area that are working to help people sign up for these appointments. So if you are in that 70+ group, or hopefully soon in the 65+ group, you can get in touch with them, or I can connect you with them through the library. And as I briefly mentioned, we're hoping that the library staff is soon going to be able to do a little bit more supportive work around the vaccination registration stuff shortly. And we do have public computers available and staff here who are totally happy to help you figure out that process. So if anyone out there, either on the call now or watching the recording later, is thinking, okay, I want to do this, but I need help getting there, we are here to help you, and we will do whatever it takes to get you set up. So
you might just really quickly put that on your library list to get to Anne's population of some of the elderly that are sort of shut in. I know there's a number, I think Healthy Island project with Renee Colson Hudson is doing this also, along with Anne, and I think Friends in Action over in Ellsworth, I believe.
Yep.
So it'd be nice to have a list that if anyone anywhere says, how can I get to these people that are really, they don't use computers, they don't have a computer, they're homebound, who can help them? There's actually a growing list, thanks to, I think, Anne and Healthy Peninsula really started a lot of this.
Great.
And there is Neighbors Helping Neighbors in Surrey is also doing it for Surrey folks. So yeah, Hannah and I have talked about putting together a list of also where you can get rides once you get your appointment and stuff like that. So once we figure out who's doing it, we'll put together a list that will be obsolete in a couple days.
Yeah, and we're definitely planning to be sharing more information about that, as a service offered by the library soon, after we just get everybody up to speed on making sure we're all equipped to help answer those questions. So
great.
Stay tuned.
Yeah. Thank you for having us. We really, really appreciate it.
Thanks
and
for being here.
thanks for the feedback too.
Thanks for doing it. Thanks, Mike.
Nice work. Thank you, everybody.
Thank you.